Director RAV, Dr. Vandana Siroha ma'am, Gurujans, I welcome you all in another intellectual session of Gyan Ganga webinar series. Today's guest speaker is Professor Dr. Chandramouleeswaran sir, Principal, Professor and Head Department of Panchkarma, Medical Superintendent, Ayurveda College and Hospital, Coimbatore, who has joined us today in 240th episode of this knowledge voyage. I, Dr. Garima Singh, on behalf of RAV, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vaidya Sri Devendra Digunaji, President of GBRAV, respected Vaidya Sri Rajesh Koteja Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director RAV. Let us begin the session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantarimaadidevam Surar Pad Padmam Lokir Jararuf Bhaimrityunasham Dhataramisham Vividhoshadinam. Om Dhanvantaray Namah. Now, I would like to introduce today's expert, Professor Dr. Chandramouleeswaran sir, who is going to throw light on the topic Raktamokshana-An insight. It is my great pleasure to introduce Professor Dr. Chandramouleeswaran sir. Professor Dr. Chandramouleeswaran sir is an eminent Ayurveda clinician, academician, researcher, and administrator with over 18 years of experience in clinical practice, teaching, research, and institutional leadership. A specialist in Panchkarma and parasurgical procedures such as Char, Agni, and Raktamokshana-Karma, he strongly advocates evidence-based and patient-centric Ayurveda. He currently serves as Principal, Professor, and Head of Panchkarma and Medical Superintendent at Ayurveda College and Hospital, Coimbatore. A PhD graduate from the National Institute of Ayurveda, Jaipur, he has treated more than 16,000 patients globally and contributed significantly to academic governance, research publications, and international promotion of Ayurveda. Now, I would like to invite Sir to proceed with the lecture.
Namaste to all my Shri Gurubhyo Namaha. There are many seniors are there. Vaidya Tripathi Saab and Gopal Bajpayee Saab. So senior, nice to see. I'm a Bachcha Aapke Saab. In front of you, a small boy is trying to present something. So my Hridaypurva Namaskaram and Pranam to all the elders and gurus. Okay. So, and I extend my gratitude and I thank the organizers of Rashtriya Ayurveda Paid, especially the head, Vandana Shirok Madam. When she came here, she told me to do this. And thank you, Garimaji, for the great introduction as well as for giving me this opportunity to present this topic. And I extend my heartful welcome to all the participants, my seniors and juniors. So I welcome you all this session. So today I'll be talking about Raktamokshana and its, insight, various methods. But nowadays, you have different cuppings and, you have this dynamic blood letting, all those kind of things. So it is picking up very well in allopathic side, also in vascular surgeries and all, they are doing it. So we'll start with that, just an insight. I will share my practical experiences also with this. So I always believe in Tadvidya Sambhasha. So if anyone has the question and I want people to ask me some questions, if possible, I can answer. So let us have the interaction kind of session rather than kind of teaching, because we are all know the basics and other things. So I would appreciate if someone can, if people can come up with question and if we can make it this one as a interactive session. Okay. So basically, if you see when nowadays, even imagine now it is Ayurveda is better actually, and people are accepting it and people are open up for so many treatments. Okay. But when I was studying in 97, 90s and all, like people used to think that what these people are doing, that kind of, so it's a kind of taboo, and it's poorly still practiced, or it is coming up, as I told, but still it is poorly practiced or poorly understood topic nowadays. And um, and it is one area where people target, it's in fact like it's easy target, convenient target to use to reticule this, like, since we use leeches, or we use like bloodletting to Raktamokshana to cure different diseases. That, like, contemporary science people, or even the scientists, the so-called scientists, and all those people used to reticule, kind of thing, and they used to think that we are very back and it's a barbaric system, why we do these things. Though, they do know that how it is helpful in various conditions. So Raktamokshana is always a kind of subject where it's a controversy is there, and people still not openly want to do the things. So I try, to teach my students, and I try to present the topic where we can literally see the results and we can break this shackle. Okay, next slide. Next slide, Madam Ji. Yeah. So basically, Sushruta, okay, is the first person to say about the role of Rakta in previous slide, Madam Ji. Okay, previous slide. So Sushruta is the person who, said about this, about this Raktamokshana. And many of us, Madam Ji, previous slide. So many of us even yeah. So many of us even misunderstands that Sushruta told Rakta is a fourth dosha, but it is not. He actually, said about Rakta Pradushya Vyadis and Rakta Pradusha Karanas and everything, but he never accepted Rakta as a fourth dosha, whereas he quotes others, not himself. Even Dalhana also, he says somebody tells that Rakta is a fourth dosha. That's the reason why Vagbhata later clarifies that he uses this word samasadaha. So he puts the full stop. Only there are three doshas, not four doshas. So Vagbhata is the person who had put that, this one into rest. So basically, Sushruta had given so much importance to blood rakta and its role in pathology, because he involved with surgery and other conditions, surgical conditions with pus and everything. So he understood the importance of rakta. So he clearly told about rakta pradushya vyadis and karanas, nidanas, everything. Okay, next slide. Next slide. Madam Ji, next slide. Yeah. So next slide. Okay. So basically, Vagbhata and Sushruta considers this, Raktamokshana is one among the Shodhana Karma. That's because especially the bloodletting, especially the Siraveda, because the whole Raktamokshana you cannot consider as Rakta Shodhana it does, except Siravedam. So if somebody want to consider, this, what is the one among the Panchashodhana in Rakta Pradusha, this, then it should be Siraveda. Okay, it should be Siraveda. Siraveda is considered as one among the Shodhana therapies, not entire Raktamokshana, because Shringam, Malabu, all those things, though it may expel some kind of doshas, the forcible expulsion of, because Yadi Ireyet Bahir Doshan, that Irana word is very, very important. That is forcible expulsion. So this forcible expulsion of the doshas doesn't happen through Shringa, Alabu, and other mode of Raktamokshanas. It happens only through the Siraveda. So only Siraveda can be considered as the, one among the Shodhana. Okay. So basically, this is just to show the importance of Rakta. So it is considered as a Dasha Pranayatana. You don't have any other dhatus considered as a Pranayatana except Rakta. Okay. And it is one among the Jiva Dhamma according to Ashtanga Hridaya. Okay. It is either it is the one among the Dasha Pranayatana, and it is one among the Dasha Jiva Dana. Okay. Jiva Dhamma. That shows the importance of Rakta in our jivana, or in our day-to-day life. Next slide. Yeah. So basically, if you see, Rakta is the second dhatu formed, okay, in sequence. So few acharyas considered as fourth dosha, okay, keeping that I already told about it, okay, and basically the clarification is already there by given in Sushruta Samhita. So and later Vagbhata is clearly told about the three doshas. And if you see one more thing further, how important Rakta is, basically the Vriddhi and Kshaya of dhatus, okay. Basically, if you see Vriddhi Kshaya of other dhatus, also depends on Rakta. Okay, this is very, very important when you study about the dhatus. Okay, if you see Rasa Kshaya, Rasa Vriddhi, all other Vriddhi Kshaya Lakshanas also told, but if you read in between the lines, or if you go through the text properly in Ashtanga Hridayam and Sushrutam or Charakam, okay, the all other dhatus, most of them depends on Rakta for the Vriddhi and Kshaya. You can literally notice this when you go through it. It's a very, very important point. Okay. Next slide. That shows the importance of Rakta. Next slide. Okay. Then we all know what is the importance of blood. Okay. It's for hormone balances, for oxygen, for maintaining the homeostasis, to maintain the health. Okay. Nutrients. It regulates the pH. All those things. It is very, very important. And blood is the basic thing. That we all know already. It is proven by Ayurveda. These are the things. The contemporary science also proves that how important it is. Okay. Next slide. So basically, this is the thing. What is the basic, the word Raktamokshana? This is the beauty of Ayurveda. Every word, the Sanskrit, every word has its own meaning. So basically, letting out the blood. Okay. So Rakta means, these are the synonyms of Rakta, you can find out like, colored, dyed. Okay. Then painted, red, okay, blood, crimson, all those things. Okay. And Mokshana means relieve or let out. Oh, okay. So letting out the blood. Okay, either forcibly, okay, or sometimes on its own is called as Raktamokshana, because you see forcibly you do, and sometimes you let out in some of the conditions. You don't take the, some of the conditions where the blood is, not forcibly, we made it to go out. Okay, so that also we can call it as Raktamokshana, either forcibly or you on its own Rakta, we need to make it flow so that, it can take care of the homeostasis can be taken care of. Okay, so basically letting out the impure blood here, basically letting out the vitiated Rakta or impure blood can be considered as Raktamokshana. Okay, next slide. Yeah, so this sloka everybody knows. This nature on the below one is very important. Techa snigdha ushna snigdha diruksha dehi sarvodosha pratipakshai samyak upakrantaha sadhyaha abhi na siddhyanti techa rakta pragopajaha tasmat eshu adrikta rakta visravanaya yata swam sram vidhet. So this is the importance of Theravada. So here Tesha Shita, this is very important. You see this line. Teja Shita Ushna Snigdha Ruksha. So it is Panchakarma. So you have this particular word is all the Pancha Shodhana except Rakta Mokshana. So you have done Snehana, Svedana, Vamana, Virechana, Nasya, you have done Vasti, all the things. Then still the doshas are not subsiding, the disease is not getting cured. Then one must understand that it is because of Rakta Pradoshaja, that is because of bad blood. So that there you must go only with Siraveda, because other than Siraveda, nothing will help. Okay. So even it shows the importance of Raktamokshana, where even Panchakar, because when we compare Shamana Chikitsa, Shodhana is better, we say Panchakarma is best. But Raktamokshana or the Siraveda is better than this Shodhana or Panchakarmas. Okay. So basically, because even some of the diseases or many of the diseases, if they are not getting cured by conventional Shamana and Shodhana Chikitsa of Panchakarma, then you should understand it is only Rakta Mokshana or Siraveda can help you. So you have to go with the Siraveda only. Very simple. Okay. Next slide. Next slide, please. Yeah. Okay. Then this is the goodness they have told. Okay. What are all the things will be prevented if the person undergoes Rakta Mokshana regularly? In Sharad Rudu, we say, it's parts of Swasthavritam, parts of the Rutucharya. In Sharad Rudu, along with Virechana, Rakta Mokshana also can be done. So basically, he won't suffer from any kind of blood disorders, okay, or any kind of growth. Here you see, this we can, take up as a research material. These are all like long-standing study. So every, this Sharatrudu, healthy volunteers, every year we can do this Raktamokshana and see like whether any growths are happening, whether cancer is happening, whether it is preventing the cancer. Until and then, we don't prove this, it will go just like that in the text. Okay. Or we'll be talking about it. So, if we can do such kind of studies, like until 30 years, 40 years, like a person, if he undergoes in Sharatrudu kind of Raktamokshana, and we can just come to the conclusion or study, okay, by doing this is what our Acharya has told. It has been already proven. So when we do this, this person doesn't suffer with these kind of diseases. So we all study this, but we don't put into practice. But slowly, things are changing. So hopefully we take up these kind of challenges, because volunteers are also coming. They want to do such kind of things. So particularly in Sharatrudu, we can start doing this so that we can think about this preventive aspect of the Raktamokshana. Okay. And basically, this is very, very important. Though Acharyas, the second paragraph, you can see here, though Acharyas told different Vedana Siras. They have told where are the different Vedana Siras, where you have to do the Raktamokshana. They clearly told, Avedya Siras and Vedya Siras. But this sentence you see very important. Blood must be let out from the engorged vein near to the disease site. So this is very simple. If you are not knowing the Vedana Sira also, if you are finding it difficult to find, and if you can find any Sira nearby to the disease spot, disease place, just do it. So this is, they have clearly told. So it is not necessary that you have to find out that particular thing and do. But if the disease is nearby, if you find some engorged vein nearby, simply you tap it, simply do the Raktamokshana there, you are good to go. Okay, very, very simple method they gave. So it is not that we have to, because many people argue, many people tell why you are doing Raktamokshana in this place, we have to do in the particular place. It's not like that, because it is told in order. If you can find a particular Vedana Sira and you can do it, that's perfect. If not, this is the method they have given. You can do this. Okay, next slide. Basically, two types of Rakta Mokshana you have. One is Shastra and second one is Ashastra. Okay. So basically, what are the Shastra? That is Prachana, Siraveda, and Kuttana. Okay. So basically, sometimes people misunderstand Prachana and Kuttana. Both are different. You can see the good thing or funny thing is Kuttana is told by only by Charaka in our Vadrakta Adhyaya. Okay. Basically, Sushruta never mentioned about Kuttana in Raktamokshana Adhigara. Okay. So he told Prachana and other things. Kuttana told only by with Suji, by Charaka, especially the reference comes under in Vadarakta Adhigara. Okay. So Shastra Vida, because since we use the needle also, you can say this. That's the reason why here they put Prachana and Siravada, but I put Prachana Siravada, but you can say Prachana, Siravada, and Kuttana also, because where sharp instruments are used, that's why it is called as Shastra Vivarna. Okay, next slide. Okay, so it is three types. I wrote it that two types, not two, it is three types, because Kuttana also must be added there. Then you see the Anushastram. So basically where indirect, where this not sharp instruments are used, where not sharp instruments are used. So Jaluka, Shringa, Alabu, then Gati Andra. Okay, so all these things comes under Ashastra Krita, because we don't use any sharp instruments. We used, yantras here. Okay, we don't use shastras here. For shastra vida, where we use shastram, sharp instruments, whereas here this anushastra. So here basically we use yantras. That is the difference. Okay, next slide. See, when you study Raktamokshana, basically what happens, you get lots of confusion. When you study different Raktamokshana methods, like how many angulas, like, whether localized or generalized, how many hasta matra or pada matra, they have made lots of, because the references are scattered here. So I put here very simplistic manner. These three slides, please carefully observe. You will have very practical idea about it. Suppose you want to do prachana, so the blood should be gradita. These are the criteria. These are the criteria I made. So Raktamokshana criteria, you just go through it. It's very simple. So if you want to do prachana, the vitiated blood should be within 2 angula. Okay, it should not go beyond 2 angula because prachana can take out the blood, vitiated blood from only 2 angulas. Okay, keep it that on your mind. So if you want to do prachana, the vitiated blood should be within 2 angula and it should be graditam context. Okay, so gradita rakta and within 2 angulas, then you blindly go for prachana. You don't need to do any other raktamokshana. One. Second, when you need to do sringam, if the vitiated blood is up to 10 angula, and if the vitiated blood is due to vata, the vitiation happened due to vata, you know the colors, I didn't go through it. You can study it in the text. It will be blackish, all frothy, all those things, all there. Okay, that you can, that is more textual. I didn't say that. So Sringa, it should be like if the blood is vitiated 10 angula and vada pradhana, then go to Sringa. And here you see among all, Sringa is the one where you use your mouth, where you suck. You know why? It is like vacuum. All other things you see, you don't do that. That is a specialty of Sringam, where you use your mouth to create a vacuum and take out the blood. So here it is usually, it is like a sucking method. Okay, this only happens through Sringa. So 10 angula, vada rakta, vada vitiated rakta, it is Sringam. Then alabu. Okay, alabu is a dry cupping, simple. You can, what you can say, alabu is a bottle guard. So if the rakta is vitiated rakta is 12 angula in length, width and length, okay, or entire round, it is circumferences. Then if it is kapha dushtita raktam, then you go for alabum. Then jaloka. If the vitiated rakta is only astamatra, so jaloka astamatrameva. Jaloka astamatrameva. So when it is only astamatra and pitta dushta rakta, then you must go with jaloka, okay, and Siraveda, Sarva Shariram. If you see the entire blood is vitiated, entire blood is bad, entire body, in the entire body, Sarva Sharira, then you go for Sira Vedam. Okay? Next slide. Yeah. Then here, according to the dosha, Gambira dosha, you must go for Jaloka. Okay? Gambira dosham, you must go for Jaloka. Then you see, if the vitiated rakta is situated in Twak, Rakta and Mamsa. Okay? If the vitiated rakta, vada, you can see vada pitta kapha both ways. If the vitiated rakta, okay, if gambira dosha, avastha jaloka. If the vitiated vada dushita raktam is there in tok rakta and mamsa, then you go for shringa. Then if the vitiated rakta, pitta vitiated rakta situated in tok rakta and mamsa, go for jaloka. And if the kapha vitiated rakta, if it is situated in tok rakta and mamsa, go for alab. So Twak, Rakta and Mamsa is the criteria. If it is Vata vitiated blood there, then Shringam. In Twakta Rakta Mamsa, if Pitta vitiation is there, you go for Jaluka. In Twak Rakta Mamsa, if Kapha Dushita Raktam is there, go for Alabu. This is one more criteria. Okay? Then comes deep-seated. Okay? If the blood is, vitiated blood is deep-seated. Okay? Then if the blood is situated in Sira, Snayu, Asti, Sandhi, and despite of any dosha. Okay? You see, deep-seated, Sira, this and all from Kashyap Samhita, okay? And Bela Samhita also. Deep-seated, Sira, Snayu, Asti, Sandhi. Okay? But less than Astamatra. Less than Hastamatra. Okay? If it is less than Hastamatra, but it is deep-seated, Sira, Snayu, Asti, Sandhi, less than Hastamatra, Jaluka, you can go. Okay? For the Dushta Raktam, less than Hastamatra, deep-seated. The same Dushta Raktam, deep-seated, situated in Sira, Snayu, and Asti, Sandhi, but deep-seated, but more than Hastamatra, go with Siravedam. Okay? Go with the Siravedam. Very, very simple, but understandable. You can put it in the practice. Where to give which Raktamokshana is very, very important. Otherwise, we always give leech and other things simply. But this one, my idea is to put in a very simplistic manner so that easily for this disease, for this condition, this Raktamokshana you can give. Okay. You can see here one example. In Gridrasi, what is the treatment? Shiraveda Agni Basti Karma. Okay. So I don't want to go further into that because there is a, people think that here there is, I want to ask, there are learned scholars also. Like people think we have to do Shiraveda, Agni, Basti, Karma, everything in the sequential order. Whether we have to do all these treatments in the sequential order or depends on the dosha avastha, either Shiraveda or Agni Karma or Basti Karma is enough. Because when the students are asking, when we see the Chikitsa Sutram, we don't understand, like we say, okay, this for Gridrasi, Shiraveda, Agni Karma, and Basti Karma is important. Whether we must do all the three or only particular treatment for particular thing, we must understand. Okay. So for me, it is like where it is necessary. This is like a broadly it has given. Where you need to give Shiraveda, there you have to give only Shiraveda only. Where you need to do Astika Agni Karma, there only you have to do Agni Karma only. Where you need to do Vasti Karma, you have to do Vasti Karma only. So Avastam Prapi Nirdishtam Kushinam Vasti Karma. So Avastha is very, very important. See the avastha and accordingly you do the treatments which is necessary there. So here you see in Gridrasi, Rakta Dushana is there, but it is more than Hastamatra. Okay. So Dushita Rakta is already there. Definitely that's why Raktamokshana should be done. But it is more than Hastamatra. That's why they said Siravida here. They didn't say Jaluka Ocharna. They didn't say Prachanna. They didn't say Kuttana here. Siravada Agni Basti Karmacha. Why they told? Because Siravida, because here the vitiated Rakta is more than Astamatram. So Jaluka won't work. The penetration will not be there. That's the reason why physician must go for Siravedam. Okay. This is one example. So depends on the condition, depends on the avastha, depends on how much, length and width the vitiated rakta is there. Accordingly, one must, depends on what dhatus also involved. Accordingly, one must choose any kind of Rakta Mokshana procedure for the betterment of the patient. Okay. Then next, this one you see, Sandhigata, Ekadeshasjam, not more than Astamatram. Okay. Jaluka. You see, Sandhigatam, Ekadeshastam also Jaluka, Sandhigatam. So if whenever you are doing it in Sandhi, blindly think Jaluka it is. You see, it is clearly mentioned in our text. So Sandhigatam, Ekadeshastam. These are the criteria. And more than Astamatra, okay, Jaluka. Though they said here, you see, Astamatra, they told for Jaluka. See, these are small Vikalpam, small points. Okay. All right. You can do more than Astamatra, you can use Jaluka also. But where you can use the clause, where you can use Jaluka, the vitiated Rakta is more than Astamatra. Though generally we told Jaluka should not be used if it is more than Astamatra. But there is one situation where you can use Jaluka even if the vitiated Rakta is more than Astamatra, that is Sandhigatam Ekadeshasjam. Okay. Yeah, sorry. Oh, I misunderstood. Not more than Astamatra. Here it is true. It is, I misread it. Sorry. So, Sandhigadam, Ekadeshasjam, not more than Astamatra, Jalauka. Same, Sandhigadam, Ekadeshastam, Graditam. If there is confusion or Graditam, then Jalauka will not be useful. Okay. Then you go for Prachanna. So, basically, at the end of the day, I want to say Jalauka Hastamatra Eva. I confused it there. Sorry about it. So, Jaloka Hastamatra, within Hastamatra, Jaloka Hastamatra eva. Clean it, keep it. Within Hastamatra, you should Sandhigadam Ekadesham Jaloka, but same Sandhigadam Ekadesham, but it is Graditam. Then Prachanam. Okay. Then if it is more than one Sandhi, Sarvadeshastam, more than one Sandhi is used, involved, and not Eka Deshajam. If it is 2-3 places, then only you can go to Siraveda only, nothing else. Okay. Next slide. So basically, if you see, this is some kind of, history made in olden texts. Okay. So if you go through the old medical texts, okay, the British text, okay, basically in olden days. Now they don't do much nowadays, these things, but in some of the conditions where in olden days they did is, okay, asthma, cancer, okay, acne, cholera, coma, convulsions, diabetes, epilepsy, gangrene, gout, herpes. So in olden days, what happened until 19th century, the bloodletting was considered as a golden therapy. Okay, so they used to do this therapy for n number of diseases. Okay, n number of diseases. Okay, so after that, slowly they stopped it. Next slide. Yeah, you can see, just like to stop some of the hemorrhages. So nasal bleed, excessive menstruation, and different hemorrhoidal bleeding also. There also they have done Raktamokshana. So not only that, even if there is a bleeding, there also just to counteract, to stop the, Ushna Mushnena Shanti, that, concept might be. So they were doing this Raktamokshana in hemorrhagic diseases also. Okay. You can see before surgery, even onset of childbirth. Okay. So they removed blood in order to prevent inflammation. And before amputation, okay, it was customary to remove a quantity of blood equal to the amount believed to circulate in the limb that was to be removed. Maybe due to, they would have done it to stop excessive hemorrhage or, something. So even before amputation also, before childbirth also, to remove the inflammation, they used to do the bloodletting. Okay. Next slide. Yeah. So now we will see a little bit about leech and other thing. Okay. So basically, leech belongs to phylum. Okay. Annelida. Okay. This is segment. It's actually a worm. Okay. Leech is actually a worm, and it is a comes under the kingdom phylum Annelida. Okay. So basically, because it has small little ring-like structure. Okay. That's why, like worms, that's why it is called as leech. Okay. And basically, it also plays in the class Hirina. Okay. That is leech. Okay. Basically, it is derived from Latin word. Okay. That is saddle, and which refer to the broad swollen, ring that is clearly visible on mature earthworm. So basically, there will be round. You see the saddleness will be there. That's why this is called as leech. Okay, in Latin, because it looks saddle. It is covered by little rings. Okay, all right. So it is like looks like earthworm. So it comes under earthworm. That's why it is called as leeches. Okay, its original name is this phylum Annelida. So this Hirudinaria of his species is very famous one. Next slide. Next slide. Yeah, you can see globally more than 700 species. Okay, whereas for therapeutic purpose, these are the 4-5 we use. Okay, more than 700 varieties though it is there. Therapeutically, we use this Hirudo medicinalis, Hirudo verbena, okay, Macrobedella decora, okay, then Hematuria officinalis, Hirudinaria manselanis, okay, Hiridinotectrena, Hiridino quinoquestanitaria, okay, Hiridino nipponia. So like this, you have, these are the species, okay. Some of them are available in India, some of them are available in Europe, okay. So basically, Assam side, if you see, this Hirido verbena is more in Assam and all those sides. This Hirido medicinalis is more in our Kerala side, or the Karnataka, Agumbe and all those places. So even these leeches also in India also, different leeches are available. The medicated leeches are available in different places, part of the India. Okay. So basically among all, this FDA in 2004, June 21, approved this Hirido medicinalis, okay, is approved by FDA for the treatment purpose. It is considered as one of the medical device, life or with life, medical device with life. Leech is considered as one of the medical life in 2004 by FDA. Okay, this Hirido medicinalis is considered as live medical device. Next slide. Next slide. Yeah. See, this is very important. You see, there are some articles. Okay, they have written, and there are beautiful books are available. Though our acharyas told how to preserve the leech. what are the conditions, how to make them happy, how to take care of them so that they don't die. But in America, scientifically, they proved that in what temperature they should be, what are the environment. They have did the study and they made this study, and this presentation or this slide is from that. Okay, you can see the temperature suitable for survival of leech range between 0 degree to 30 degrees Celsius. So if you are keeping the leech outside 45 degree, 46 degree in summer and all, definitely it will die. So always keep it in under AC. That is better. If you are having the leech, then it will be beneficial to them and it won't die, or it can suck easily also. Okay. So basically 0 degree to 30 degree. Okay. They are very, very sensitive to temperature. So easily they die. So you must give them a cold temperature. Okay. And basically then for therapeutic purpose in leech farming, it is recommended by FDA that the animal must be maintained without feeding at a temperature range of 4 to 13 degrees Celsius, and water volume area per animal should not be less than 0.7 ml, with typically 10 to 15 leeches being held in a large jar. So this they have standardized. So basically what they are saying, though up to 30 degrees is okay, but therapeutically, if the leech you want to have very good therapeutic, outcome, you must, always fresh water, and 4 to 13 degree Celsius, okay, should be maintained. And for the swimming or the volume for per leech should be 0.7 liter, and maximum 10 to 15 leeches, okay, held in a large jar. Okay, this is scientifically proven. Okay, next slide. Next slide. Yeah. So basically, leeches take up oxygen dissolved in water. All types of contamination causes stress to the leeches, causing secretion of mucosal layer over the body. That's why, when you are taking a leech, if you feel it is very slimy, you are not able to catch, don't use that leech. Okay, that means, it is contaminated. So you need to wash that leech properly and put it in a new container so that, you can use it next time. So whenever you are using the leech, you are taking out for the purpose of Raktamokshana. If it is too slimy, if it is too, slippery, that means it is contaminated. So don't use that. Okay. So basically, other thing is leech are hermaphrodite, basically, but still they need a other partner. So though they are hermaphrodite, they need other partner to get the reproduction. Okay. And it takes 2 to 3 years. And only you must use the leech which is young, that is not below 2 years, or maximum not above 3, 4 years. So use the adult leech which is usually 2 to 3 years of age. This and all they have scientifically documented. So the age should be 2 to 3 years. Okay. Next slide. Next slide. Madam, the next slide. Yeah. So these are the things you can say, like, what leech contains, anticoagulant, anesthetic, thrombolytic, okay, vasodilator effect, okay, all these things you see it is there in the leech saliva. That's the reason why we can use. Okay. So basically, it should be non-chlorinated water, and it should be stored in a sterile container. Okay. And if possible, people change it like every 3 days or 7 days and all. Okay. But I would suggest change the water every day. Very, very important. Please change the water every day if you want to have the leech for longer duration. Okay. And if you want them to bite properly. Okay. Next slide. Yeah. So now this is kind of my work. We always study about poisonous, non-poisonous, and in our text they have written some kind of description they have given about poisonous, non-poisonous. So here one thing I want to simply say: the land leeches are always poisonous. Okay, understand? The land leeches are always poisonous. So don't ever use land leeches. One. And second, don't ever use if the leech is very, very big. It is called buffalo leech. Though it, some places they use like it is black color. Never use buffalo leech. If the leech is very big, that is poisonous. Danger. So don't use. So land leeches are all poisonous. So don't ever use land leeches. So you can see these most of the leeches there. So thanks to the Google, I searched Google, it took me so many days to get these kind of things because not much is available. So these are all, most of them are land leeches. You can see, okay, Krishna is poisonous. You can see that is buffalo leech. Big blackish color, that is buffalo leech. Never use big and black color leech. That is very highly poisonous. So that is Krishna. Then you see Karbura, where you have small, small thorn-like thing in the leech. You have, once again, you can see it's a land leech. So there is a thorny structure is there. So it is Karbura. Then you see this Indrayudam. Second, then the fourth one also, like Karbura, where you can see the small, small ridges are there and the small, small spikes are there. Okay. So that is both these four are like, you can, first one, you can see the Krishna, first two Krishna, second two is Karbura, last two is Indrayuda. So you can see different colors. You can see Indrayuda colors. Okay. Like they looks like Indrayuda. So different colors. These are all land leeches. So you cannot use them for bloodletting. Okay. Next slide. Madam ji, next slide. Yeah, you can see, okay, this is, both are actually, we use it, for your, this one, okay. You can see the Pundarik Muga, okay, lotus mouth, Hirudino orientalis. Okay, this is good leech. Okay, the back, the previous slide also, if it is green and yellowish, Mudgavarna, you remember? Mudgavarna they told. You can see the previous slide, that Mudgavarna is there. That kind of leech, blindly you can use it. It is Hirdoverpina actually, that is. That Mudgavarna one, and side you have that yellowish, na, that is Hirdoverpinalis. Beautiful leech. You can always use because it is greenish in color. It is good. And this is Hirdo, orientalis. This is also good leech. This you can see greenish color is there. But you see in the top, small, small lines are there. If you find the small, small lines and the side yellowish color, greenish color, and the top, if you find small, small line, use it. It is very safe to use. Okay. Next slide. Yeah, you can see Iridoverbina. I showed you that green color, you see, and Irido medicinalis. When you come across these kind of colors, blindly you can use them. You see downside, you have that whitish color. Okay. Upside, you can see that small, small greenish color and small dots. And it has a nice, what you say, that streak is there. And that is, Irido medicinalis. Right side, you see Irido orientalis. Verbena will be little bit more greenish color. You can see here Mudgavarna. So Mudgavarna is there, small, small lines are there. And if you see the horizontal lines are close, whereas the poisonous leeches, the horizontal lines you may not see, and the horizontal lines will be big also. Here you see the horizontal lines are very, very close, and it is Mudgavarna, and nice streaks of yellowish color is there. So when you come across these kind of two leeches, they won't give any side effect. Blindly you can use them. Okay. Next slide. So basically, this all, we all know, okay, how to collect the leech, how to nourish the leech. It is told in our texts, okay, what to feed the leech, everything. So we will skip. Next slide. Yeah. So nowadays, where you can use this leech, okay, you can see this black leech. They just put it here. I put it here, but you can see though it is black, anything black, don't use it. But this leech is black, but you can see the ridges are nearby. So it can be used if herbinalis is not there or all those things not there, you can use, but still very careful. So in the present area, paralysis, sciatica, alopecia, lymph nodes, inflammatory reaction, hemorrhoids, filaria, eye diseases, sinusitis, ear problems, throat problems, you can use these leeches. In many conditions like a varicose ulcer, we use varicose veins, we use discoloration, we use for hair growth, we use. Okay, all those things. Even if there is a nice big acne, cystic acne, you can use. So it depends on the condition. You can use it in many. It's a very broad spectrum you can use. Next slide. Next slide. Yeah. So method of application. So here certain things you must understand. So basically, never ever, as I told, they are very temperature sensitive as well as smell sensitive. Okay. So basically, what you do, don't apply any kind of, this, what you say, iodine solution, or don't apply any kind of spirit. Okay. Nothing. Or don't use any soap water. Okay, all those things must be avoided, and definitely avoid abhyangam. You can use steam because steam will help to do the more blood, pool. Whereas never ever use abhyanga because of the smell itself, it won't bite. Okay, so because they are very very smell sensitive, and always find out the oral side. Very important. Find out the oral side. And when you try to catch, many people I have seen, they catch it with the, I know it is very difficult to catch the leech. You use already the rubber gloves. When that rubber gloves is very, very smelly, that puts off the leech. Okay. So what you do, rubber gloves you use, then still, use one kind of nice cotton, dip it in water. Okay. Dip it in water. Our dip it in water, that's soaked cotton. Try to use that cotton to catch the leech. Okay, very very important. All right, and automatically when you apply, easily it will catch. And always one more practical point I will tell you: don't try to wait until it catches. Always make one small prick. Nothing will happen. Okay, sterile needle, use one small prick, let the blood come. Okay, because leech likes the blood. Without blood, sometimes the leech, you would have all practitioners would have experienced it. So make a small cut and apply. Easily the leech will drink. So basically, two things here you need to remember: catch the leech after sucking, after soaking the cotton ball into cold water. Then with that you catch the leech. Then the site clean with the normal cloth. Then nice steaming you give. Then make a prick. Then apply the leech. Okay. Once the leech is fully taken, blood it will fall up. Okay. Second, still it is drinking, but if the patient is saying that, I have itching sensation, I'm getting pain, I feel something unusual, then also you must remove the leech. Okay, next slide. So, basically, here you see, once if the leech is not leaving, the person developed some side effects, then put salt, okay, or turmeric. Here how to activate the leech, I already I skipped it. It's very simple. Always you do one thing: before applying the leech, please activate the leech. And in order to activate the leech, I always, wherever I go, I say don't use turmeric to activate the leech. And especially the turmeric powder what you are getting from the market, we don't know what it is. So many times the leeches are dying. And one more thing, you see, we use the turmeric to vomit the blood, right? To make the leech to vomit the blood. But you see, it is written in our text also. But you are using the same turmeric water to activate the leech. Imagine how then leech will bite. I realized that when you put the leech in the turmeric water and make it active, it is not biting. You can see in your practice. I started using, or I tell people to use takra. Takra is the best thing. Because you can see, in order to remove the leech from the site also, we are using the turmeric. So it is a bitterness leech doesn't like. Whereas takra is Swadu. So it activates very well, and takra can remove the sliminess and the dullness of the leech. So basically, in order to activate the leech, please, my practice is don't use turmeric water. Or if not, maybe we must use the turmeric tuber, make a powder out of it, and maybe you can use that. I'm not sure about it. But in my practice, what I started feeling is, in order to remove the leech, use the turmeric and the salt. And in order to activate the leech, simple sterile water or takra is more than enough, not turmeric water. Okay, next slide. Next, yeah. So it is Pura Karma. We all know. Okay, here though I written, after this old side, that's why I wrote turmeric powder. So basically, I told you Sneha Svedana means like internally, externally, but not just before the leech application. Don't do that, and don't use turmeric. And always activate the leech. Many places, okay, they don't activate the leech. Ensure that you are activating the leech. You keep it 30-40 minutes in the tray so that it run here and there. The funny thing you want to say, you must make that fellow happy. If you don't make that fellow happy, he will not do your work. So make him happy by activating him. Okay, that's very, very important. And all other precautions, what I told, you follow. Next slide. Next slide. You see this slide and all I want to remove. Okay, so this is what I told. Okay, I don't use turmeric water anymore. So, and basically, as I said, prick the skin and apply. Okay, sometimes if patient is very, very, this is one more thing here, very, very important. Close the eyes of the patient. Don't allow the patient to see that. Sometimes just to say I am going to take out the bad blood. Sometimes don't say I'm going to put leech. Many people say they don't want, especially females and all. They will get fear, or they will come and say that because you put leech, I have some itching issue like that and all. So basically, don't say you are going to do leech. If possible, always do it in the minor OT or major OT. Here, one more thing I want to say: when you do this Raktamokshana procedure, all those things, you say, okay, give me 500 rupees. They think that it's not worth. They think that, oh, these people did something, they put some leech, they are asking us, they think because the leech is freely available everywhere, you get it. Why we need to pay like that? So make it bigger. Make it like a surgical procedure only. It is a parasurgical procedure, right? So Shalya people should think that it's a parasurgical procedure. What and all precaution you take? You wear, what are like how the surgeon, while doing surgery, you do gloves or, the head thing or, all those dresses, you know, make it big. Properly explain to the patient. Many places, many times we fail to explain to the patient the procedure. No need to tell about the leech, but you tell how it is going to help, what you are doing, why you are doing, everything, including, how the cost, everything you explain them. Otherwise, they think we are simply doing something, we are asking them 500 rupees, 800 rupees. Because I see in my practice, whereas they go and give under 1,000 rupees consultation to the allopathic person. So we have to change. So don't, do it just like that. Make it big. Show it big as if you are doing some big procedure. Very, very important. Okay. And always, as I told, prick and make it bite. If the person is very timid and other thing, maybe you can try with honey, ghee and everything. And always do it in aseptic condition. Always do it in minor OT or major OT. Always, have one or two people with you. Always monitor the BP before and after BP monitor. Check the vitals. Close the eyes. Make the person to relax. Okay. It's all very, very important. Don't terrify the patient because it is like many people, even in mild surgery also they fear. So making the patient comfortable is very, very important. So please keep all these things in your head. Next slide. Next slide. Yeah, so basically, so you can see I told about some soap water. So if you have soap, it doesn't have any smell, because there should not be any smell. That's it. You can use whatever you want. Any strong smell should not be there. Oil or soap or antiseptic, anything. If it is too much smell, it won't. So wash it properly, dry it. Okay, then you can use it. Okay. Next slide. Okay. Basically, here one more idea I will tell you. Simply, you would have seen when you try to put the leech, it falls off, right? Or it goes here and there. It tries to slip away from our hand. So what I started doing that. What I started making one thing. You just how you do it for Kativasti and Grivavasti. You make with the this powder. Okay, you make one pali or the dam-like structure with this black gram. Okay, masha. What you can do na? You can dip a cotton, make it like a vati, cold water, and make like a dam-like structure. You hope you are getting my point. So it is like 1 centimeter or 2 centimeter height. So make like a dam-like structure, okay, and put the leech there. So this one will prevent the leech to go here and there, or this one will prevent the leech from falling off. This one will prevent the leech from falling off. So you can make like a poly, okay, with the simple, gauze or with the simple our cotton, okay. Then you can apply like a round, gauze thing you can apply as a poly or as a dam. Then in the middle of it, you put the leech so that the leech cannot fall off or the leech will not run away here and there. Okay. All right. So that one practical tip I want to create about this gauze barrier I told. Okay. Next slide. Okay. Next slide. So this is the thing. Okay. And always basically you do one thing. Whenever the leech is sucking, always put the nice cold water, dip it in the gauze, dip it in the cold water. Don't forget to do this. Okay. Next slide. If there is a pain, if the patient is saying pain or uncomfortness or itching, you must remove it immediately. Okay, you must remove it immediately, because when the leech is good, if there is no problem, if there is no poison, if there is no issue, there won't be any pain when the leech is sucking. This is very, very important aspect. This you must keep it. So if the leech is not poisonous, if it is good, the patient will not feel any discomfort. Okay. So always try to apply, depends on 3 to 4 leeches. Okay. And if the patient feels pricking and itching, remove the leech. Okay. And if you want, you can use different leech in the different site. Okay. Next slide. Okay. Then if it is blood, okay, you have done the leech, still the blood is not arrested, you can use Yashtimadu. Always use powders. Okay. Raktastapana. Yashtimadu powder or any Raktastambhaka powder like, Rakta Chandana, all those things you can use. If nothing is available, don't worry. You can use Dushi Vishari Agadam and Vilvadi Guliga, make a powder. Just apply there. Immediately, it will stop the blood. Okay. And pressure techniques and tight bandage you can apply. Next slide. Okay. Then this is the leech care. Everybody knows, otherwise it will get the Indramadam. So basically you need to do the Vamana of the blood which is taken by the leech. Okay. So gentle squeezing must be done. And definitely you throw, Saindhavam and as well as turmeric in the mouth of the leech so that it can expel all the blood from the mouth so that the leech can survive. Okay, next slide. Next slide. So basically, if you see how much blood it takes, 5 to 10 ml. Okay, basically, and always nowadays I tell people, if possible, use, don't reuse the leech. Tell the patient if they are ready to afford, use new leeches. And once you use the leech, throw that leech. Okay, no need to use in other patient. Always use the fresh leech for the patient. And if the patient you are planning for 2-3 sittings of Raktamokshana, same leech can be used, then you can discard it. But don't use the leech in the other person until and then if it is thoroughly cleaned. Until and then if if the leech is sterile, then you can use the leech in other person also. And definitely you must give 15 days of time, okay, in between the procedure. Okay, very, very important. That is the time you give for the digestive tract to take care of, or any bacteria or anything is there. This one will digest. So that's the reason why 2 weeks is important. Otherwise, you can wait for 3 weeks or 4 weeks also if you are trying to use it in some other patient. Very, very important, because the leech has two bad bacteria. Okay, one is Aromanus veroni and Reccanella. Both are highly dangerous. You don't have any antibiotics to take care of this. So once if somebody gets the infection out of the leech, please, friends. So we cannot do this to the patient. So we must be very, very careful. So these two bacteria can instilled through the leech saliva, then it is highly dangerous, because you don't have, because many of the antibiotics are resistance to this bacteria. So we should be very, very careful. Okay. It can create, you can see, infection and septicemia. So we must be very, very careful. So if the person having itching after the bloodletting, you can give Dushi Vishari and Vilvadi internally as well as externally. Then if there is an increased pain in the site, then you can give Dushi Vigari, Vilvadi Guliga, okay, Srisha, okay, and Karera and Aragoda Kashayam or powder. Okay, next slide. Next slide. Yeah. So these things better to avoid. Okay. Hemophobia, all those things. Then complications. Okay. If there is any kind of hypovolemic shock, sprinkle cold water, IV fluid. Infection, maintain aseptic precautions to avoid. If there is infection, go for antibiotics. Okay. And always use iPad. Okay. Next slide. Next slide. Okay. You can see Jalokavachana. This is a recent advancement where you can modify. So after cupping therapy, we can do Jalokavachana. What is the speciality of this? You get the leech can drink more blood. Leech can suck more blood, because by cupping you already brought in so much of blood inside to that particular area. So easy for the leech to bite, and the sucking will happen fastly. More bloodletting can be done. Okay. Next slide. Okay. And basically, these are the mode of action. It is very long, lengthy. So I'll skip this. Okay. How it is in the antithrombolytic, antiplatelet and everything. Next slide. Okay. Inhibitory action, coagulation. Okay. Yeah. So it is microsurgery. Nowadays in modern science, they are using. Recently, maybe 6 months back, from medical college, Coimbatore Medical College, I got a call from a plastic surgeon. So he said that, doctor, we want some 1 or 2 leeches, because we did anastomosis, we did a vascular surgery of the finger, okay, little finger and the ring finger. Okay, but we see some kind of slight gangrenous formation. We cannot do much about it. So if you can give the leech, we can help, we can put the leech so that it can improve the circulation. So that particular surgeon, vascular surgeon and the plastic surgeon, both, they gave me I need to search the photos. So they used our leech and they could able to successfully save that person's fingers. Okay. Recently, 6 months back, it happened. So in vascular surgeries, they started using. Nowadays, they started using in dentistry also. The dental implants, where in the inside, if there is a pus formation or if there is a abscess formation, they are using the leech to suck out that. And in the microvascular surgeries, they are using, and in some of the heart surgeries also, where they want to take out the blood or where there is a clot is there. Now they started doing research on putting the leech so that it can remove the clot. Okay. So all these areas where leech therapy is gaining popularity. Okay. The next slide. Okay. And you can see cardiovascular origin like acute, subacute, and chronic thrombophlebitis. So that's why we put in thrombophlebitis and all. We put leech therapy so much like in venous ulcers, thrombophlebitis or cellulitis due to blockage of our veins. Okay, so varicose veins. Where you get this phlebitis, thrombophlebitis cases. It's fantastic. Okay, you can use the leech. Next slide. Here in the hemorrhoids, you see if there is a thrombosed hemorrhoids, if it is little bit inside, but practically you can use the leech to remove the thrombus. Okay, and if the hemorrhoids is also out, you can maybe outside also you can make a small prick and put the leech. It can remove the bad blood from the strangulated hemorrhoid, so it can help. And if it is outer ring, easily you can, if possible, with the help of in a scope, you can apply the leech so that it can thrombus hemorrhoids also can be taken care of. Okay, so nowadays these are the areas where this leech therapy is used. Next slide. You can see basically this macroglacia caused by hematoma after placement of dental implants. So in dentistry, it is very much is useful. You can see the dental implants I already told. You know that from India, every year around 7 lakhs leeches. You can search in internet. I think now it would have gone more. Minimum of 7 lakhs leeches are being exported to US and other countries for this macrovascular surgeries and other things. There are certain places where they are growing leech in a large scale also. So every year, so much of leech, especially the Hirudo medicinalis, is being exported from our country. Okay. Next slide. Okay, this is in dentistry. You can go through. I'll give my slide. Next slide. Okay. Then I told about the Shuddha Rakta Purusha. Okay, this is there in our text. You can go through. Next slide. Okay. You can see, I try to explain this. What do you mean by Avagada Rakta Dhatu? Okay. So Avagada Rakta Dhatu, we come across for bloodletting. So some of the, because when we study, I always try to find some answer. What could be the reason? What they would have told? It may be correct. It may not be correct. Okay. So basically, Avagada Rakta Dhatu, what I found is, so suggest about the specific properties of leech that causes removal of Rakta Dhatu that has its affinity towards the erythrocytes components of the blood, and its capacity of promoting blood loss through anticoagulation effect, inhibition of platelet aggregation, and extracellular matrix degradation. Okay, so in Avagada Rakta Dhatu, leech is indicated. Why it is indicated? This could be the reason I wrote here. Okay, so just I try to find out what could be the science behind why they told in Avagada Raktam, why leech is indicated. This could be the reason. Okay, next slide. Okay, um, um, this is about Atyayika also. This one can be used in Atyayika. Next slide. Okay, then next slide. It is a goodness of bloodletting and goodness of why it is happening like that. So this is about the prachana. Okay, so here localized area bloodletting through multiple incision. So here pade padamachres they told. Here one thing you understand, the pada should be from down to up in the straight line, avoiding the veins and down to up. Whereas imagine like when you're doing it. Going down to up is always a bit difficult, right? When you cut, because your hand is your muscle memory is like that. From up to down, it is very easy to cut. But Acharya has told down to up. You may just think and tell me what could be the reason, okay? What could be the reason why they told from down to you have to cut upside, okay? Not from up to, from upside to down. What could be the reason? So basically tourniquet must be placed. Then, you can see I'm doing it here. So after placing the tourniquet, then when you are doing this insertion, when you're trying to do the kuttanam as well as the prachanam, it should be fast. Understand, your hand movement should be very fast. Otherwise, patient will get pain. So within like, imagine like a maximum, 90 second to 1 minute, like 10 15 cuts or 10 15 straight vertical lines, not cuts, vertical lines, at least 5 to 10 lines should have been done within a minute, so that we say now without with the blink of the eye, when the person says pains are, you should finish. So your hand must act that much fast, otherwise the patient will not cooperate. Okay, next slide. You can see this is Kuttanam, where you always for Kuttanam, it is very good to use insulin syringe. You don't need, people use this normal needle, 5 ml, 2 ml, साथ आता है ना वो needle नहीं चाहिए, don't use that, is very big. Patient will be very painful. So this insulin needle, it is sharp and almost, what you do now, one more thing, when you're doing this, don't use the same needle. When you feel that the pricking power has, nothing wrong in, using one more. So let us create something so that the patient won't feel uncomfort or pain. Okay. So here also all the pura karmas I didn't mention. So aseptic condition, wearing the gloves. Okay. Since it is no jaluka, you can use, this, aseptic conditions. Okay. What you say, our, iodine solution or spirit you can use, clean it, then you can use it. Okay. So you can use the insulin needle. And if the needle is not sharp enough, immediately change one thing. And here also within minutes, immediately you should just prick lots of random pricks you do. Okay. Then automatically allow the blood to come. And this is the reference. Okay. Charaka Samhita, Chiksatana, this is Vadaraktam. There only it is told this Kuttanam, Tat Punjat Asruk, Shringa Jaloka, Suchi Alabhihi. So this Suchi word told by Charaka. Next slide. Next slide. Madam, next slide. Yeah. So what is the therapeutic action of Prachana? Previous slide. What is the therapeutic action of Prachana as well as Kuttana is thrombolytic, anti-inflammatory, immune stimulation. Okay. All these things it does. Next comes the Shringa. Okay. So usually cow or deer horn is used. Next slide. And they are cleaned and applied by oil. All the interiors are cleaned. You can see. Okay. It is where the sucking is done. Okay. And always it is snigdha in nature. That's why it is used in vata. Not only that, we always put oil to make it shine. Okay. Inside as well as outside. So cows on or deer's on is used. Done in areas where supta. Okay. Supta rakta. Where there is a suptata of the twak. So Shringa is used. Okay. Next slide. Okay. This is already mentioned in our text. So base, how much width should be there, how much length should be there. All those things they have used. They have told. This already you know. Next slide. Yeah, this is like modified Shringa Yandras. If you don't have the ons, you can use in olden days. These are the things they used. Okay. With copper, with the iron, with this bamboo or with even the wooden rods they have used. Next slide. And this is nowadays, it is done, it is a modified Shringendra, where the vacuum is created, all right, and the machine is there, it creates the vacuum and it sucks the blood. Okay, this is available in the market. It's a modified Shringendram. Okay, next slide. Okay, this is the features of Shringam. Okay, basically, all right. So loss of sensation, Vata dosham, Vata raktam. Okay, if it is deep seated, because you are going to suck it. So when the vitiated blood is deep seated, okay, then you must use the Shringam. Okay, next slide. Then comes the Alabu. Okay, and vitiated blood by kapha, shringa should not be used. Okay, and blood vitiated by vata or vata associated pitta condition. Okay, shringa must be used, not alabu. And they have given the diameters, thickness. Okay, and everything in the text. Next slide. Okay, here once again, if you want to use the Sringam, small incisions, once again, aseptic areas must be selected. Suktada area must be selected. Small incisions, 3 to 4 or 5 to 6, how much blood you want to remove, make incisions. Then immediately place the horn, okay? And that horn should be firmly held on the site. There should not be any vacuum or any air should not go, because when the air goes, it is like vacuum method. It cannot suck. So basically, strongly you place the stringum. There should not be any hole from the sides, so that it should be airtight, just airtight. When you keep the stringum airtight, then you with your mouth you suck, so that vacuum is created that will suck in the fat, muscle, as well as the twak inside the stringum. And because of the tightness, the blood vessels are constricted and the blood will start oozing. Okay, this is how it should be done. Okay, next slide. Okay, here I want to skip all those things. I have tried to analyze what could come under Vadaja Raktadushti, Pittaja Raktadushti, and Kafaja Raktadushti. So this is my idea of doing things. Okay. So basically, you see Vadaja Raktadushti, when you compare, this is just my understanding for my because I told you as well always, like, how to understand Raktadushtis. So just I tried my best to put all these things. Take the example, if there is a Vadaja Raktadushti. So what are the things can come under Vadaja Raktadushti? Inherited disorders like hemophilia, then von Willebrand's disease. Okay, a low level of vitamin K, where the coagulation is not happening. Okay, you can see the coagulation doesn't happen, where the frothy kind of thing. Then cancer that begins into or spreads to the liver, other liver diseases including hepatitis and cirrhosis, long-term use of powerful antibiotics and anticoagulants, which is medicine that thins the blood thinners. So all those things can be considered as Vadaja Raktadushti. This is my idea of putting, because how to understand them. Next slide. You can see some over-the-counter medications like non-steroidal anti-inflammatory drugs, aspirin, and medications that includes NSAID. Aspirin can cause bleeding problems or make them worse. Okay, anticoagulants and thrombocytopenia or low platelet count, anemia, which is unusually low level of red blood cells. So all these things, maybe we can bring it under Vadaja Raktadushti. It is my idea. People may agree, people may not agree. That's fine. If you have any other idea, I'm ready to learn. Okay. Next slide. Then Alabocharna, it is using the bottle guard. It is nothing but the cupping therapy. It is used in Kapaja Dushta Raktam. Next slide. So Alabu, you see, you must use this Alabu, not that big one. Okay, Dudiyana, not like the longer one. You cannot use that for bloodletting. And one more thing, it is not the one which is edible. You use the wild Arabu. Nowadays you get it in the forest area only. Why wild alabu? They are very small in nature. It will be very, very small, like, because when you want to use it as a cupping therapy, you want to suck the blood from the vein. So you cannot use very big thing because that much surface area is not available. If it available also, because of the angulation in our body, the vacuum will not be created and the sucking will not happen. So it should be small only. So this is like you can see the small alabu. So they cut that, you can see down is big and upside is very small. So where that smaller and bigger is joining, no? So like there you need to cut and you need to use nicely, you need to polish it so that the cut the edge which is cutted, na, the cut the where you made the cut, the edge should not be sharp, then it will hurt the patient. So you must use this emery paper or the sandpaper to make it very, very smooth. So the edges should be very, very smooth. Okay. So you make the edges smooth by using the sandpaper and other thing. Then you can use this alabu for alabu avacharna. Okay. So use it in any kind of growth or granthi or cyst where you are, where there is a pus and other thing. Alabu avacharna is used. Next slide. And this is then, and in the longer one also, if you see the head, so that head part is small. So you see here the longer one, the smaller one. So in the smaller one, always both the head part you should use, not the body part, because they are small. When the mouth is small, better they will suck the blood. If you use the bigger mouth, vacuum will not be created. You cannot use the alabu, and alabu must be dried. You cannot get the alabu in the market and make it dry. It will get spoiled. So you must leave it in the in its the creeper itself. So after some time, it will become fruit. Then it will become in the sun. It will become dry on its own. That dried alab only. If you break it inside, you will get the seeds. That seeds are used for further. You next year and all you use it so that you get the fresh alab. So remove the seeds and you must wait until it is dried up on its own. After that only you can use the alabu. You cannot purchase something in the market and dry it because that will get spoiled. Okay. Next slide. Okay, it is indication blood vitiated by kapha, psoriasis, arthritic pain, stiffness, cyst, tumors, abscess, cystic acne, in all those things where you want to suck the bad blood and use, you can use. Next slide. So this is the indications. Okay, this is what kind of alabu must be used, dimension and everything they have mentioned. Next slide. Okay, these are the characteristics of a bottle guard. Next slide. Then these are the features, like features of alabu, length, width, circumferences, everything. This Next slide. Okay, this is the procedure. Okay, basically tourniquet is applied. Okay, multiple small, once again, everywhere aseptic condition. That is what I explained for leech. Multiple, small incisions are made. Then, you put a small wick inside the alabu after dipping it in the oil. Then ignite the fire. Okay. Then immediately you should apply that on the affected area. Then immediately that will create a negative vacuum that will start adhering to the skin. Okay. Tightly. Then because you made the cuttings, the blood will start oozing. Okay. Next slide. Okay. So this is how you apply. Okay. So this is the principle of action. So vacuum is created and the fire is extinguished. Okay. Then the blood is coming out. Next slide. So what happens with the alabu and the Sringamandal? Availability problem and sterilization problem is there. Next slide. So cupping. Nowadays, the modified Alabu and Sringam and Gati Yandram is nothing but the cupping. Okay. So Alabu is traditional method, cupping is recent method, and Alabu medicinal benefit, cupping may not have medicinal benefit, and Alabu comparatively difficult to perform, cupping is easy to perform, and Alabu difficult to clean, cupping is easy to clean. That is the difference. Okay. Next slide. Okay, it is types of cupping. Dry cupping, that is without blood. Wet cupping with club with blood is wet cupping. Without blood is dry cupping. And one is with Agni, that is fire cupping. And other one is without fire cupping. In fire cupping also, with blood and without blood you can do. Okay, next slide. Okay, basically it takes around 20 ounces of blood. Okay, usually 5 to 6 cups of used. Okay, per cup takes out around 4 ounces of blood. Okay, around 20-25 ounces of blood we can take it from the body. Okay, next slide. Okay, it is glide cupping where cupping is heated and it is glide throughout the body. Okay, so on workshop if we can conduct, I can show all these things. Since it's a presentation, it's difficult for me to show. It's called glide cupping where you just immediately but in all this cupping and other things, friends, one thing you I understand, your hand should be quicker without shaking. You need to do tuck 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 immediate fast. Otherwise, patient will get pain and he will not cooperate. She will not cooperate. Okay. So where it is, the gliding is done with the with the help of heat, with the help of cup. Okay. That is called gliding cupping. Next slide. Okay. And the timing in the morning hours. Okay. And once again in Unani, they are told it should be avoided in the month of lunar month. Okay. Because Rakta will be initiated like that. If somebody want to follow, you can follow. There is nothing wrong in it, but it depends on the disease condition. You can do it anytime. Next slide. Okay, next slide. Okay, glass vessels, needles. These are the things you need. Okay, next slide. Okay, next slide. It is how the cupping has evolved. This I want to skip. Okay, next slide. Okay, basically the dimensions and everything I have mentioned about the cupping is you can go through. Pre-operative, post-operative is same, aseptic condition. Okay, so basically BP, blood works definitely. Ask the person to stop coagulants, aspirin or anything he takes 1 or 2 days, or at least at the previous day night or on the day of bloodletting therapy. You must ask the person to stop the this blood thinners. Second, always do check for HIV, HPV, okay, TB. Definitely, the infectious diseases you must check in the blood. Blood work is very, very important before doing any bloodletting, no matter what. Okay, and always check the vitals before and after. Okay, next slide. Next slide. Yeah. So next slide. And just skip these slides. This is how to apply. I have written. Next slides. Yeah. Yeah. Okay. Next slide. So once the cupping therapy is over, okay, you can always cover the cut, where you made the cut with antiseptic solution and other thing, and nice massage also you can do, if it is a dry cupping, after cupping, you can do nice massage so that, blackish, you can always tell the patient whenever they go home, there will be some blackish discoloration, reddish discoloration will be there 3 to 4 days or 1 week. Nothing to worry, that is because of cupping. And if it is a dry cupping where you didn't cut the blood, you didn't take out the blood, do nice massage, then you send the patient. And if you are doing a wet cupping, that is removing the blood, then put antiseptic solution, nicely cover the wound, then send the patient home. Okay, if needed, give Nimbadi Gugulu or Amrita Gugulu so that the wound can heal very fast. Okay, so basically these are the point of applications you make, and definitely follow the aseptic conditions. Next slide. Okay, next slide. These are the different areas where it is indicated, how it is indicated, why it is indicated. I have written this. You can go through in the slides. Okay. So these are the side effects: bruising, ecchymosis, blisters, all those things. You should be very careful. These are the side effects. Okay. You can always tell to the patients. Next slide. Okay. So possible mechanism of action. Okay. This also I have written. You can go through it. Next slide. Next slide. So you can see these are the conventional cupping, and that is the alabu. This is how I practice. These sets I have. It's available everywhere. Next slide. Modified alabu with fire. You can see. Next slide. With fire, without fire. You can see with blood, without blood. Okay. Modified Gadi Yandram. Even if you don't have the cupping, use the tea glass. Here you see I'm using tea glass. It's very simple. If anybody has any pain, umbilical pain and other thing, easily you can use. Next slide. Okay. Then once again, I try to find out what is Kavaja Dushta Rakta. This you can go through, like polycythemia vera can be said as Kavaja Dushta Rakta. Next slide. Yeah. So next slide. So I try to find out answer what could be the Kavaja Dushta Rakta. These are the nowadays diseases. You can treat it as Kavaja Dushta Rakta. Next slide. Next slide. Yeah. So lastly, before I conclude, in Delhi, in Nizamuddin, there is one Hakim. He doesn't have any kind of qualification or anything. You can still go there in New Delhi the Friday when they do the prayer. So they use, you can see now, antiseptic, nothing. Okay. And they use the clear, blade, new blade. Just he make the patient to people to stand, and there is a big you see there will be a big well, and there is a big water tank. So people will be standing, he will be putting the tourniquet, just like that randomly he will cut, and he will send the patients. Next slide. You can see this is what. So lastly, I want to conclude with this. If this person can do, we are all studied people, we have qualification, we can also do Raktamokshana very effectively and efficiently. Thank you.
Thank you so much, sir. Now I request if anyone is having any doubts, you may please ask to sir.
Hello. Yeah, good evening, sir. Thank you very
Good evening,
much
madam.
for such an informative and elaborative lecture. I have few questions, sir. First is, can you, hello, am I audible, sir?
Yes, madam.
Yeah. Sir, please provide with some reliable source from where we can get leeches, because many times what we get from the local vendors that causes some toxic results like itching, redness in the patients. So some reliable sources. And number two, can you also explain little bit about leech cultivation if possible? And number three, sir, how much fall in hemoglobin takes place and in platelet count takes place? Any research studies per leech? Because in cases of diabetic gangrene or other types of gangrene also, we need to apply, uh, many leeches at a time, because the growth of the condition is so fast. I mean, the gangrene spreads up so fast that repeated application of leeches has to be done, and it is I have found it to be very effective. But at the same time, yes, also I'm concerned about the fall in the hemoglobin and platelets. So do give some guidance about it. Thank you so much.
Thank you, madam. Good evening. So basically, regarding the leech, I can give you one person. He's a doctor himself. Okay. So as I said,
Mhm.
I do get it from people. If you want to cultivate, basically we have to go ourselves only, because we are getting from people, our nearby. There is some areas in near Kerala and all. We try to get it from there, but the problem is you don't get it throughout the year.
Yes,
Okay.
yes,
So
yes.
better, I always say people that nowadays leech cultivation should be part of the institution itself. Okay. Or part of your hospital setup itself, so that we don't need to rely upon people. Okay, so
True.
that is a kind of task, but we can always do that. So that is your first question. So leech cultivation, as I said, when there is a finding out the proper leech, I told you about how to find out them. Okay, you can
Yes.
search even in the net or books. It is available. Okay, or
Yes.
the local farmers also can tell. Okay, then you can either get it from Assam or other places. Once you have the leech, then they themselves will like multiply. Okay, so properly you can with the AC and proper food and other things, it can be cultivated, not a problem. Okay. Second, I'll give you one number. You can take down. That person is reliable and he is giving us a good
Yes.
amount of good leeches. And you see one more thing, you don't have any kind of standard to test that leech, whether it is basically most of them are non-poisonous, and we don't have any equipments to do that. We, as you said, we have to do research on that. Okay. But
Yes, sir.
basically, the person who sends it, you must know, as I told you, see that Mudgavarna, the green color
Yeah.
and the side Manashila Varna, always that is safe. If anything
Yes, sir.
black or anything too colorful, don't take it. In a simplistic
Yes.
manner, if you want me to tell, this is what I want to tell. Irido Verbena and Irido medicinalis. Okay. So
Yes.
green color,
Yes.
Mudgavarna, that lots of, I told you about the streak. If you come across that leech, always blindly you can take them because they're safe. Okay. So that kind of leech, if you can arrange, you can take it always. Okay. So I'll give
Yeah.
that person's number. You can take down
Please.
99867
Yeah.
48124.
48
124
124.
99867 48124. You can contact him. Okay.
Yeah. Thank you so
He
much.
seems
Yeah.
to be reliable. And coming
Yeah.
to the hemoglobin level, ma'am, when you are using leech, always, if these kind of conditions where you want to use it repeatedly, I would suggest you, I do sometimes, go with some kind of natural hemoglobin enhancers. Okay. Like our, aristas or our syrups are available. Okay.
Mm.
So those syrups you can always, but usually I think maximum 0.5 gram or 1 gram only it will be reducing, not like alarming level of studies has not been done. Definitely we can take up this study, the PG centers and PhD centers can, this is a very fantastic study. It would be how much, hemoglobin level are getting reduced if it is done. But when you do 1 or 2 sittings, I found out like, I have tested in
Yes.
maximum maybe 2-3 cases, like 0.5 grams, madam. And maximum in one case, it has gone to 1 gram, not more than that. Okay. But repeatedly every 3 days and all, if you are doing, maybe I can even check here once again and we can come conclude. But I don't think so. It will be more than 1 gram or 2 gram. And if somebody is trying to do it repeatedly, then definitely to support, it is better to give some kind of,
Hematinic.
medicines which can improve the, hemoglobin in the body. Okay.
Yeah. Yeah. And any effect on platelets, sir? Have you come across?
Yes, platelets will definitely go down, madam. If there is high platelet, na. So in dengue and all also you can use. Okay. It helps to, reduce, if there is more platelet levels, it helps to reduce the platelet levels.
Okay.
I used it in 2
Okay.
cases of dengue where they had lots of knee pain and other thing. Internal medicines were not working. So I used the leech there. And next time, I didn't particularly check for platelet. I just wanted to treated them for knee pain. But still, I want next day or 2-3 days back after that, I wanted them to take the platelet count, whether it is, decreasing or increasing. Like, there is a kind of change in that it was happening, madam.
Okay, sir. Okay.
Yeah.
Sir, can you just tell, I mean, from where I can get information about leech cultivation?
Leech cultivation, as I said, you need to contact the local farmers only. Okay. So they are the one who knows better, madam. And otherwise, there is in Google, you can search, there is in American Association is there for leech
Yeah.
cultivation and leech, this one. You can write to them, madam. But I think they can help you in manner where, all the materials and other things they can give you. That's how I got it from them, the temperature and other things, whatever I mentioned. It is from them only I got it, standardized way they are doing it.
Okay. Thank you so
Yeah.
much, sir. And randomly, I couldn't read the slide completely. Correct me if I'm wrong. Somewhere it was written that leech can be applied in the cases of acute MI. Have
Yeah,
I
they
read
are in
correct?
allopathic, they started doing it, madam. Okay, like after opening the heart, it is not like above the thing. Okay, so
Mhm.
in vascular surgery, in all those things, in MI and all, where they are not able to, in some tricky areas where you cannot do the angioplasty or where you cannot remove
Yes.
the thrombus, they are using the leech there. Okay.
Okay.
So as far as outside is concerned, we don't know, madam, because when there is a myocardial infarction, we
Yes.
obviously
Yes.
we will refer and we don't take a risk for doing any treatment. So as now the integration is happening, people are open. Maybe in future, along with their treatments, we can ask them, okay, let
Yes.
us. It is nothing wrong in it. Let us put some leech also in the area of heart and see how it is working. So if people are very open, if the cardiologists are open, if the big corporates are okay with that integration, then definitely these things can be tried. And I believe that there will be some kind of results in that, madam.
Sure, sir. Yes, I feel the
Yes.
same. Thank you so much,
Yes.
sir. Thank you so much. Yeah.
You're
Yeah.
welcome, madam.
Nice
Thank you.
talking to
Yeah.
you.
Sir,
Yes, madam.
hello, sir. I have one question. Is it
Yes.
important the location is the location of application of leech important, sir? Because it is acting systemically, sir. Systemically, the uridine is being transferred. So, can you explain that, sir?
It is just due to the because usually when you do this transfer, there will be kind of coagulation, blood circulations will not be there, and lots of foreign bodies are there. Basically, the antibodies will accumulate. Okay, so probably leech would be removing all these things, and it would be improving the microcirculation. Basically, microcirculation. Okay, so when it does that, basically that's how it could be helping actually.
Okay, sir. Actually, sir, in cases of psoriasis, where there
Uh-huh.
is excessive scaling,
Mhm.
it is difficult because the leech doesn't readily
See, in
suck actually.
psoriasis, if it's Salvador system, only Seraveda you can do, ma. If it is a patch is very, very big, then you can slightly slowly scrap the this whitish scale. Then there will be might that aspect signs like bleeding will be there. There you can put the leech. If the lesion is very big, then that lesion will go down. Okay. But if it is Sarvadeshastam, many places is there. Leech alone cannot be helpful. You must go for Siravada only.
Okay, sir. Okay, sir. And sir, about the use of takra, you said instead of haridra
Yeah.
for activation
Yeah.
of leech.
Mhm.
So, can we do
Yeah.
it practically, sir? Like when we
Of course, you
do.
get majiga, takra everywhere. Now you can prepare in your home and put it. That it's very simple, na.
Okay, sir.
And never
Okay,
use
thank you.
this turmeric from at least from the cover mein aata na. Those things. It's horrible. We don't know what colors and everything is going on. So if you want to use, because I have seen it, it makes the leech die, or sometimes they don't even go here and there. They don't swim at all. And the bitterness, I've seen, you can literally see you put the takra 10 leech and you put 10 leech in the turmeric and you make them bite, you'll understand what I say. Practically, I have seen it. That's why I'm saying this.
Yes, sir. Okay, thank you, sir.
Sir, one more question. You have said
Yes, ma'am.
that it is ideal to use the leeches of age 2 to 3 years.
Mhm.
Uh, how to find out if I'm taking from some vendor, local
See, on
supplier?
the adult leech, they have given length, width, and everything, and you'll know that in the body that ridges also. Okay, so
Okay.
that with that only you can find out. They have
Okay.
given the parameter length, adult leech length, the width, and the mouth, all those things they have written. So you need to measure and then only you can find out. And
Classical
the weight
description has
weight
to be
weight
followed.
also will be there. Weight also should be done. The young leech, if it is not adult, the weight will be in the gram, it will be less. So length, width, and weight and the color. Okay. These things you
Okay.
should understand.
Okay, sir. Thank you.
Thank you, sir. Do we have any other questions?
Yes, please. I would like to put in a question. Hello.
Yes, yes.
See, once I applied a leech to a patient of psoriasis, and first time it worked well. And the
Mm-hmm.
same leech after 2 weeks gap, again I
Mm-hmm.
applied.
Mm-hmm.
Then she had developed severe pain after 4 or 5 hours, and she bled for some time, and this bleeding continued, and pain, especially pain, she could not sleep. And later on, just I treat it as the hypersensitive reaction, keeping her on steroids and like that. So how is it the same leech? When I applied first time, there was no problem, and after 2 weeks, she reacted so violently.
Yeah, see,
Hello?
that could be because of the poisonous leech. The entire thing what you are narrating is that's because of the poisonous leech.
No. What my question is that the same leech I applied first time, and she was okay. And after 2 weeks, again the same leech applied. Then she got reaction. The first time, the same leech. I am talking about the same leech. First time there
Same
was
leech.
no
First
problem.
time was good. Second time it's an issue, right?
Yeah. That is what I'm saying.
See, that happens. Basically, this, if you ask me frankly, even I don't know. Okay, this happened in my practice also. Why? Because that is the reason why I told it is better to use some use and throw thing. Okay, one time you use and throw. Otherwise, you wait for one more month or like month until it completely becomes normal. These standardizations still we don't know. Okay, in foreign countries, what they do now, once they use the lease, they don't reuse it. Okay, to the same person for the other person also, they don't reuse it. Okay, so that is the thing basically. So basically, what we can do is to prevent this, we must actually use the new one only. Otherwise, we have to wait at least 1 month, so that it can be all right. And why it is happening, we don't know. Maybe like some kind of immunological reaction would have happened inside the leech body, or something would have triggered. Okay, so really, even I don't have an answer for that.
Okay, thank you for your frank answer.
No problem, sir. Truth is truth, no, sir.
Yeah, that's very nice.
डॉक्टर साहब बहुत बहुत धन्यवाद, बहुत बहुत बधाई। बहुत सुंदर प्रेरणादायक आपका व्याख्यान रहा। बच्चे बहुत ही प्रसन्न हैं आपके व्याख्यान से सुन करके। बहुत बहुत राष्ट्रीय आयुर्वेद विद्यापीठ का आपका हृदय से बहुत बहुत आभार और साधुवाद।
धन्यवाद सर, आपका आशीर्वाद बहुत बहुत धन्यवाद है सर। सो काइंड ऑफ यू
आपने, और अच्छा व्याख्यान है, प्रेरणादायक रहा। बच्चे बड़े संतुष्ट हैं और राष्ट्रीय आयुर्वेद विद्यापीठ ऐसे कार्यक्रम समय समय पर करते करे। बहुत बहुत बधाई आप सभी को।
कभी भी सर, कभी भी आप बुलाइए, हम आ सकते हैं। मुझको हम भी राष्ट्र निर्माण में है, हम कभी भी हेल्प हम करेंगे। और मुझसे क्या आता है मैं करता हूँ सर। मैं कोयम्बतूर है सर, तमिलनाडु कोयम्बतूर में सर।
ओहो, ऐसी में सर नोएडा में है। नोएडा में लोग थोड़ा कम विश्वास मानते हैं ना, नोएडा की स्थिति खराब है। नोएडा में हम लोग हैं, कुछ लोग।
हाँ, नोएडा में ठीक है सर। हाँ,
नोएडा में है ना, तो लोग कम विश्वास मानते हैं। हालांकि एक दो हमारे शिष्य हैं जो लौका करते हैं, तो असली में ये मिल नहीं पाती आसानी से।
मिलता है सर। मैं दूसरा 2-3 लोगों का नंबर भी हूँ, मैं देता हूँ। कोई किसी को मेरा नंबर ले लीजिए, वो दे दिया है, उसमें करता हूँ सर। वो अरेंज करने का मुश्किल नहीं है सर, कोई प्रॉब्लम नहीं है सर।
अच्छा, आपके प्रोग्राम यहाँ पर होते हैं क्या? विद्यापीठ में कराएंगे? एक आध विद्यापीठ में कराइए, उनसे कहिए विद्यापीठ करावे का चलौका का प्रोग्राम यहाँ पर रक्तमोक्षण का। अभी तो रक्तमोक्षण प्रोग्राम तो है सर इनका, कहीं रक्तमोक्षण का राष्ट्रीय विद्यापीठ का हो गया कि हो रहा था रक्तमोक्षण के ऊपर? अभी विद्यापीठ का वर्कशॉप होनी थी रक्तमोक्षण के ऊपर, मुझे पता नहीं कि हो गई कि नहीं
सर। वो भी सर अब नेक्स्ट ईयर का होगा।
अच्छा, ठीक है। इनको बुलाइए, जरूर इनको बुलाइए, यही करिए, रजिस्ट्रेशन ही बुला लीजिए आरएबी में। हाँ, बहुत अच्छा व्याख्यान रहा और बड़ा साइंटिफिक इन्होंने बोला, बहुत ही साइंटिफिक व्याख्यान रहा इनका। चलिए, बहुत बहुत धन्यवाद सर आपको।
थैंक यू सर, सो काइंड ऑफ यू। आपका आशीर्वाद हमको बहुत ऊर्जा मिला है सर, बहुत धन्यवाद है सर। जरूर हम आएंगे सर, हम करेंगे सर, कभी भी आप बुलाए तो। मुझको क्या थोड़ा मालूम है वो देता हूँ सर। मैं तो इतना बड़ा आदमी नहीं हूँ, छोटा बहुत मालूम है सर। मैं वो ऑलवेज वो एक्सप्रेस कर सभी के मैं बोल देता हूँ सर, क्या मैं कर रहा हूँ, सच ही बोलता हूँ सर।
ठीक है सर, आपको जरूर आरएबी बुलाएगी आपको। धन्यवाद।
धन्यवाद सर, धन्यवाद सर, थैंक यू सर।
Thank you, sir. On behalf of the organizing committee, I would like to thank Professor Dr. Chandramouleeswaran sir for delivering such an insightful lecture. I would like to extend my sincere gratitude to our mentor, Vaidya Devendra Tirunaji, President GBRAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vandana Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Koteja ji, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would also like to express heartfelt thanks to all the gurus, shishyas, and other scholars who, with their presence and active contribution, make this seminar a successful one. Last but not the least, I thank each member of RAV organizing team who worked behind the stage to make this event successful. Thank you, sir.
Thank you. Namaste all. Good night. இப்போ